I am Dr. Denton Stam. I'm a cardiothoracic and vascular surgeon. I am a chest surgeon, so I operate on hearts. I do bypasses and valves and arrhythmia surgery. I also work on the lungs, so I'll do removal of lung cancers and diagnostic tests and sometimes surgeries because of infections around the lung. Interestingly, I was named after a heart surgeon. Many years ago, my father watched Dr. Denton Cooley do surgery and named me after him, and I ended up actually training in Houston, Texas, where Dr. Denton Cooley was, but not at his institution. I went to college with the intention of trying to go to medical school, wasn't sure, and then got in and started liking it, and then decided I wanted to go to the top and be a heart surgeon. I have a very long history of really good relationships with my patients. I try to be very honest with them and keep them up to date on things. I don't want them going into surgery without knowing what's going on, and having them have a good sense of what to expect and be comfortable with things is utmost importance to me. They do much, much better when they're aware and comfortable with things going in rather than being scared. So I take lots of time with my patients, take some time to learn them, their families, and treat them as a patient, not just another body. We have a great team. They know how I like things done, and I came back and we just hit the ground running. Everything's so much easier because they know how we like things done, and it makes things really efficient. Well, my best advice for patients are to quit smoking, because that causes the majority of diseases that I actually operate on. Hearts, lungs, vascular, all related to that. There are obviously some other factors involved, but I think the one thing that people can do to help themselves the best is to quit smoking. Probably the most rewarding thing about my career and what gives me my greatest satisfaction is seeing patients that have something going on with them, potentially even fatal, that I can fix and give them a better quality of life. And that's really what it's about. But I want them to have an experience that isn't a frightening one for them, but can give them, an excellent outcome. And so that's what gives me probably the most enjoyment about what I do, is just seeing people when they come back in the office and they're doing well and they're happy with things.